प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन सेकंड हाफ उत्तरार्धान आमी आसात आनी आमचे बरोबर आसात गोयचे नामनेचे डायनॅमिक डॅशिंग आनी सामके हायली एज्युकेटेड सुपर स्पेशलिस्ट ऑर्थोपेडिक सर्जन डॉक्टर आदित्य साई. म्हाका दिसता बरेचशे प्रश्न आमकां येत आसात आनी तुमचे जे आमकां रिस्पॉन्स आसा इज रियली एनकरेजिंग. तुमचे आनीकय प्रश्न विचारता त्यांचे स्पेशलायजेशन आसा म्हणजे ही सुपर स्पेशलिस्ट इन द नी जॉयंट मॅनेजमेंट आणि शोल्डर जॉयंट म्हणजे हे तांचे दोन खाशेले आवडीचे विषय आणि तज्ञ आसात. तुमच्यानी प्रश्न विचारू येतात. आमकां परत सांगता तुम्ही ज्या डॉक्टराची ट्रिटमेंट घेता ताचें नाव सांगपाची गरज ना. यू कॅन जस्ट से दॅट यू हॅव बीन ऑलरेडी सीन बाय ऑर्थोपेडिक सर्जन. वखद घेता ताचें आमकां नाव सांगल्यार कळटलें एक्झॅक्टली वॉट मेडिसिन यू आर टेकिंग आणि प्रश्न विचारात मोकळेपणान विचारात. डॉक्टर एज वी वर गोईंग आय आस्क यू वन सिंपल क्वेश्चन which I really love to ask these days. These are the days lot of vitamin D3 sachets are available of different companies. In fact, it's fad. Market is full of the different company. Are all these vitamin D3 supplements needed in the way they are propagated or marketed or even prescribed, to be very specific?
Okay.
With due regards and respect to everybody.
Yeah.
What is your opinion?
See, as far as I am concerned, no.
Yeah.
I am of the opinion that India is a tropical country.
Correct.
So you have adequate sunlight. Even 15 minutes of exposure is enough for vitamin D.
Correct.
But having said that, there are certain groups of people who require vitamin D supplementation, especially perimenopausal women.
Yeah.
Okay. In the first 5 years after menopause, calcium supplementation therapy and vitamin D3 supplementation helps them in maintaining the bone density. The other group is those who have already crossed their 80s. Okay. So these are the two groups of people in whom I would advise young males, I mean young guys or women. I definitely won't suggest you require calcium supplementation as such.
Correct. So according to you, enough adequate sunlight is available. First of all, our people, because nowadays we also are so busy, we don't have time to go to sunlight. Every time we are on the bike, we are on this, we are in the car. Once we go to office, we are not out. In fact, people have not seen the sun for so many days also. One thing. So that is one thing. And what I liked is you mentioned very categorically that perimenopausal patients and postmenopausal require calcium as well as vitamin D. But this additional vitamin D is required or what available? See, every tablet usually comes with vitamin D and calcium. Is that sufficient or additional dose is required as it is available? Like say 60,000 international units and all, whatever.
Yeah. See, that kind of a dosage is required when we diagnose somebody with vitamin D deficiency.
Otherwise, it is not so. Okay, I have another question, but I will ask you subsequently. Till that time, let's take this question. Hello. Hello.
Hello.
Yeah.
Hello, doctor. Hello, Dr. Panjeechan उलयता.
उलय.
Regarding my mother. तिचे नी सकयले पाय सुजता.
सुजता दोनय.
दोन्ही सुजता.
एज
आणि नी तांबडे जाले.
एज
एज अराउंड 70.
अच्छा, तिका डायबिटीज प्रेशराची आणि किती दिवस
ना ते काहीच
ना चेक करून पळयला
सगळे चेक करून
बरं म्हणजे का ते दोपर दुखता का फक्त सकयल सुजता होच प्रॉब्लेम
दुखना फक्त सूज येता
swelling in both the legs below the knee joint.
Okay. And any heart problems or hypertension?
No, she is saying that there are no other problems. Okay. सगळे प्रॉब्लेम तुम्ही चेक करून पळयला नाही बाकी सगळे इन्व्हेस्टिगेशन केला. Okay, you can.
Yeah. Firstly, good evening. See, if she is having swelling in both the legs below the knees, that indicates a problem is existing within the body. Okay. It need not necessarily mean that it has to do something with the knees. Now, when we have somebody with having swelling in both legs, it can be due to any problem of the heart. It can be due to any problem of the kidneys, high blood pressure. So these are the things that commonly cause swelling below the knee. If it was due to some problem in the knee, she would probably be having a degree of pain in the knee also. Okay, and the problem would be centered around the knee.
Okay, so definitely means it has to be evaluated properly because I think even I felt that what she's saying that though there may be some hidden pathology somewhere. Okay, shall we go to the next question?
Sure.
Hello. Hello. Hello.
Hello.
Vichara.
Good evening, doctor.
Yeah, good evening.
I'm Sarla Rajadesh from Margaon. I'm 50-year-old and I used to go for walk from last 20 years.
20 years?
Yeah, and suddenly I used to get pain also in my knee. So I went to doctor. He used to give me the medicine.
Yeah.
Now suddenly I noticed that I cannot bend my knee. So I went to doctor in Vocard only.
Yeah.
Doctor told me, in Vocard only I went.
Yeah.
Doctor told me you require knee replacement. And he said, still you are young, no necessary, at present you don't go for the knee replacement.
Yeah.
But after 10 years, you have to go back for that.
Yeah.
So I was wondering, despite doing exercise, how I got this pain and this knee replacement at this age.
Sarla madam, I really liked your question.
Yeah.
But what I can just comment, it is not an expert's opinion. Expert is sitting here. If you have to not go for exercise, perhaps you should have set in early.
Now the problem is,
No, I got
I wanted to ask the doctor whether,
Yeah.
I wanted to ask doctor whether I can go for walk right now, because doctor told me not to walk for 1 hour and only 20 minutes is enough.
Okay.
Hello.
Yeah, this
Can you
academic
hear me,
type of question, so doctor, you are yes. Yeah.
Shall I answer that?
Yes.
Yeah. Good evening, ma'am. See, first of all, probably you have been diagnosed with knee arthritis. That's why you have been suggested knee replacement, but not right now. After 10 years, she's right now 50 years of age, and even I will not, suggest knee replacement at that age.
Correct.
Because I mean, the later we delay the knee replacement, the better it is. Okay. There are other modalities of treatment which we can consider in our age. Having said that, now I'm glad to say that she used to walk for some duration every day.
Almost 1 hour.
Yeah.
She mentioned it.
Which not a lot of people do. Now, what I would suggest to her is, if she walks for 1 kilometers or 2 kilometers every day, that is fine. So, I mean, whether she can do it in 1 hour or 20 minutes, it it's up to her. Just a slow walk, that's enough. Okay. The caution I would advise to her while walking, the most important thing is she should not walk on uneven surfaces. What happens is, in an arthritic knee, the balance of the forces is already disrupted. So, when she will walk on uneven surfaces, her pain will get exaggerated. Okay. Other than that, for her knee pain, of course, she can try with physiotherapy. Okay. If it does not improve with physiotherapy, then there are definitely other options. See, painkillers and everything will not cure the problem that is there inside the knee joint. For curing the problem inside the knee joint, we need to do something other than that. Physiotherapy is the other thing than knee replacement or any other arthroscopic procedure that has shown to have good relief.
Correct.
So, after physiotherapy, if the pain does not decrease, then there are other modalities available without thinking of replacement, like arthroscopy, in which there are procedures now which I am glad to tell you, which we can repair early arthritis of the knee.
Okay. So, madam, I think this one more thing is that, see, days are changing, every day newer things are coming up, and so definitely whatever new things are happening, and if it is in the interest and giving the benefit and result to the patient, they should opt for that, and they should go for it. Because, see, maybe that they have consulted, she must have consulted some other doctor, where I am not saying that it is wrong something, but
definitely,
so newer things are coming up.
Newer things are coming.
And newer doctors are also coming. Okay, so let's take the next question. Hello.
Hello.
Yeah.
I'm from Ponda, and I've called. My mother is suffering from arthritis for last 12 years, and she's been taking painkillers for more than 6-7 years. I just want to know that is there any other cure, means accepting painkillers, and what are the causes of these painkillers?
Okay, one more thing I want to know, arthritis, what are her exactly problem, where she is having the pain?
She's getting shoulder problem and hand problem. She can't lift her hands up.
So, the problem is in the shoulder?
Yeah, shoulder. Most problem is in shoulder.
Okay.
And her age?
Age?
Age 60.
Okay.
Good evening, ma'am. See, the thing is, with shoulder arthritis, there are a lot of things can be causing pain in the shoulder. Okay. So, arthritis as such is erosion of the joint. Okay. So, if the cartilage is gone, we call it arthritis. Now, it can be caused due to rheumatoid arthritis, in which your own body produces some chemicals that act against your various joints.
Correct.
The other is osteoarthritis. That is one thing. Then in the shoulder, specific to the shoulder, as I said, there are a lot of tissues around the shoulder. Any imbalance of them can cause arthritis, any rotator cuff problems. Okay. Having said that, painkillers for a duration of 6 years is not advisable.
Definitely.
Because I feel for that duration of time, if you take painkillers, you will end up with other problems which are more serious and more difficult to treat.
Okay. So, definitely she should go for I can say that she can go for second opinion, get proper evaluation, come to the cause, and then go for the management rather than just taking the painkiller for such a long time.
Agree.
Correct? Let's go for the next question. Hello?
Hello.
Yeah.
Doctors, I have got one daughter, 6 years old.
Yeah.
And she often complains that her knees pains.
One or both?
Sorry?
One leg or both?
No, both the legs. Sometimes she complains, and this complaint has been like when she was 2 years old. From that time onwards, she's complaining that her knees are paining, like, you know, and the whole legs and all that.
I see. Oh.
And the second question is like, I'm 37 years old, and my left hand.
Pardon? Hello? 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 Okay. Somehow I think it got disconnected. She said she has a daughter of 6 years and pain, often frequent pain, because she's saying almost last from so many years the girl is complaining of the pain in the knee joints. What can be a probable cause?
See, this is a problem which is very common in growing children. Okay, the leg bone which forms, it grows from the upper end also. So these are especially characteristic of growth pains at the upper end of the leg bone.
I see.
So these are some things that stay for 2 to 3 years or maybe 4 years, and they get resolved on their own. Okay, but of course that is one of the most, that is an established cause, and that is a common cause, but there can be other causes also which you need evaluation. It can be any other thing inside the bone that is causing the problem, any cyst or any problem like that. So it needs a proper evaluation, but having said that, that's one of the most common causes.
So so it is quite common. Means you should not much panic, but definitely proper evaluation, establishing the cause of the pain is to be done, and then I think once if it is established, then it is nothing more pathological. Then
worry much about it.
As she grows and once that suggestion is occurred, I think the pain will also be taken care of. Doctor, we have got another question. Hello.
Hello, doctor.
Yeah.
Yeah, see, I'm a lady of 45 years old.
Yeah?
Yeah, my problem is now my hands and legs were getting numb. Muyata, Muyata. In daytime, even if I stood at one place, I was getting the numbness. So I went to one health center, and then I did a blood test. And in my blood test, I came to know that my vitamin D is less. Below, even less, it's normal, not above average, not below average, average. So I was prescribed with vitamin T, Uprise D3, 60K, which I took for 1-2 months, once a week. Shall I continue with this? Because I am not getting that relief. Still, I am getting the numbness. I have to continue this how long?
Before you finish your question, I'll have another question for you. Have you checked reassessed your vitamin D level now after taking this medicine?
No. But still the numbness is coming. No, that's why I didn't go. I wanted to get all right with this and then go and do my blood test again. Because I'm still getting the numbers. It has reduced to little, but not exactly.
Achha. Okay. Are you working?
No, I'm a housewife.
Okay.
Good evening, ma'am. See, vitamin D deficiency as such, very rarely causes numbness. See, we have a lot of tests. If we do 100 tests in a normal person, 10 tests will come
minimum
out of range, or something will be less or wrong. So what I'm trying to say is, okay, vitamin D is less in her, of course that needs to be treated. But a more common cause of numbness in hands and legs and paresthesias is a vitamin B12 deficiency.